Thank you, Dr. Blase. You are recognized.
Thank you, Chairman Buchanan, Ranking Member Doggett, members of the committee. It's a privilege to testify before you today, particularly since I was once a House staffer. My name is Brian Blase. I am president of a new health policy think tank, Paragon Health Institute, and my testimony today represents my own views. I will focus on how well-intended government policy aimed at making health coverage and care more affordable often does the opposite. For example, the Affordable Care Act caused premiums to soar. Individual market premiums more than doubled in the first 4 years after its implementation, yet plans covered fewer doctors and hospitals. By 2021, the average ACA plan premium plus deductible for a family of 4 exceeded $25,000. Since coverage is cost prohibitive, most enrollees need extremely large subsidies to afford these plans. Taxpayers pay for more than 80% of the premium on average and pick up almost all the cost of premium increases over time. This gives insurers significant pricing power and in turn leads to higher premiums, an inflationary spiral. At the outset, it's important to acknowledge some basic truths. First, the U.S. does not have a free market for health care. Half of U.S. healthcare spending is by the government. Most of the rest is heavily impacted by government policy. As government's role in healthcare has expanded, prices have skyrocketed. Hospital prices have increased more than any other major economic sector, rising 3 times faster than inflation since 2000. By contrast, in sectors where government's role is minimal, inflation-adjusted prices typically decline while quality improves. Too often, high healthcare prices and spending don't correspond to high value and improved health. For example, the ACA expanded coverage and significantly increased spending primarily through Medicaid, but American life expectancy declined for 3 straight years following the ACA's coverage provisions taking effect. In fact, Americans' life expectancy was lower in 2019, before the pandemic, than it was in 2013. There is too much government bureaucracy in healthcare. Government rules, despite good intentions, often restrict options for coverage and care, stymie innovation, and prevent providers from being able to best meet their patient needs. Government also mismanages programs to an epic degree. There's $100 billion in annual improper Medicaid payments, for example. There's too much insurance bureaucracy in healthcare. Insurance is important, but having insurance pay for routine and shoppable services leads to overconsumption and waste. People often secure better prices by not using insurance. One study estimated that cash prices are 40% cheaper than prices with insurance. For healthcare services where third party is limited, such as cosmetic surgery and LASIK, real prices have declined while quality has increased. Moving forward, you should keep 2 principles in mind. First, policy changes always produce unintended consequences. We should evaluate the outcomes, not the intentions behind policies. For example, many ACA proponents thought it would reduce ER visits because people would get a usual source of care. The exact opposite happened. ER use surged with the ACA, often for non-emergent care. Second, when government subsidizes something, it becomes more expensive. Subsidies increase demand, raise prices, and increase total spending, and must be funded by taxpayers. Both the American Rescue Plan Act and the Inflation Reduction Act expanded the ACA's already substantial subsidies. Most of the benefit went to people who already had coverage. Families with incomes well above $250,000 now qualify for large subsidies. The expanded subsidies incentivize employers to drop workplace coverage, raising overall deficits. And all the new spending on the expanded subsidies also increases inflation. Congress should consider building on existing policies that expand coverage options and improve incentives, including association health plans, which allow employers to have economies of scale in obtaining health insurance for their employees, making coverage more affordable. Individual coverage health reimbursement arrangements enable employers to offer coverage by making tax-preferred contributions that their workers can buy coverage that works best for them. Price transparency rules empower patients and employers to know prices before purchasing services. And health savings accounts give people incentives to ensure value from their health care expenditures. In conclusion, Congress should trust people and let Americans have the freedom to spend their own money on the health care and coverage that works best for them. Thank you again for the opportunity to testify today, and I look forward to any questions.